When you take a look at the type of work that we do, we focus mainly on the medical affairs function within the biotech or pharma company. And that medical affairs function, not too long ago, was very small, very narrowly focused. And now, driven by more education and more research, those groups are growing significantly. They're delivering more value to the organization, and with that comes a significant amount of complexity. So in our partnerships with our clients, we help them navigate that complexity, we help them evolve their organizations, and we also help them with specific product strategies with a focus on additional research.
As part of my role specifically as a director, I'm not only responsible for helping with that project work and ensuring that the projects that we sell are successful and answer the client's questions, but in my role I also am responsible for selling projects and ensuring that we're able to identify potential problems that we could help clients solve and approaching clients with our potential solutions, talking through those with them, which then eventually typically leads to a consulting project.
It would not be unusual during the span of a week to be involved with a pretty high-profile pitching our consulting business against the competition. That same week we may also facilitate a full-day working session of some 30 or 40 people, which could be about transforming a medical affairs organization. And lastly, with the individuals that we are responsible for, that is for managing our talent, we'll work on specific projects with them, guiding them through the deliverables and the output to make sure we are delivering that value to our clients. We've been very fortunate to have two of our clients rely on us heavily, and as a matter of fact, they had a recent merger. So we're involved in integrating a group of some 800 global medical affairs professionals, and the type of work we're doing with that integration is everything from project management of multiple work streams, to harmonizing policies and SOPs, to much more strategic efforts in creating brand new departments, brand new functions.
Currently working on a couple of projects. One of the projects is helping a client understand whether or not their current strategy is going to work as a new competitor enters the market. They're already in a competitive marketplace, but really want to pressure test whether or not they need to change their strategy, or if not their strategy, what tactics they need to change in order to ensure that they're able to maintain their market share as the new competitors enter the market.
And if you look at our main efforts in education and research, there are a number of other business units and inVentiv that have a similar focus. And the consulting services we provide and the solutions and services they provide are very complementary. And the three groups really at the top of the list are the late stage group, the medical communications group, and inVentiv Therapeutics Institute, who provides both contract MSLs and nurse educators. With late stage, we're finding more and more that medical affairs teams are doing more of the evidence generation, running registries, running small trials, sometimes pre-approval and sometimes post-approval. Our colleagues in late stage in inVentiv Clinical have some of the deepest knowledge in the industry in this area, and it's a very, very collaborative approach we have with them.
The one opportunity to collaborate with another business line for me specifically in consulting has been with inVentiv Clinical. Our client wanted to understand how the future market was going to evolve based on impending competitors that are expected to enter the market. And as part of this project, they wanted us to speak with therapeutic area experts to gain their perspective on the likely entry of particular molecules in development and how high of a threat each of those molecules was. Working with inVentiv Clinical, we were able to identify the therapeutic area experts in that disease area. From there, the project then completely transitioned into the consulting group, and we're able to identify how the market was likely going to evolve and then provide a recommendation to our client for how they should be thinking about the market in the next 5 to 10 years in order to be successful.